November 2002, Yvelle Hall, an 86-year-old female patient from Cafferley, Leeds, sustained a broken hip and underwent surgery at Leeds General Infirmary, LGI, in Leeds, England. After a month of treatment, Hall was eventually proclaimed healthy. However, in December 2002 at 5:15 a.m., she suffered a sudden situation, hypoglycemia, and collapsed, dying. The results of Hall's blood tests revealed that she had been injected into her stomach with a large dose of insulin that was purposefully mixed with someone to kill her. Because no doctor or member of the medical staff had prescribed it, and Hall did not have a condition that required her to be given insulin at 12 times the normal level. The autopsy also revealed that Hall had brain damage due by acute hypoglycemia. When the storage room was searched, the insulin was gone from the hospital refrigerator, and the last person to have access to it was male nurse Norris, half an hour before Mrs. Hall collapsed and died. Colin Campbell Norris from Elgin Terrace was born on February 12, 1976, in Glasgow's Milton neighbourhood, Scotland. Norris began working for LGI immediately after graduating from college in June 2001. Norris was also working at St. James's University Hospital in the same city during the Hall incident at LGI. Norris predicted Hall's death to another nurse just moments before she passed away. As a result, LGI got suspicious and contacted the police. West Yorkshire Police initiated an inquiry. Norris was detained on December 11, 2002, but was freed on bail pending further investigation. His employer, Leeds Teaching Hospitals NHS Trust, fired him the next day. West Yorkshire Police later looked into earlier deaths at St. James Hospital where Norris also worked. Police discovered 4 other women, 3 of whom died from insulin overdoses: Bridget Bork, 89, Doris Ludlam, 80, and Irene Crooks, 78, and 1 survivor, Vera Wilby, 90, of Rawdon. Norris treated 79-year-old Irene Crooks at St. James Hospital on October 10, 2002, due to a broken back. Although Norris reported that her condition was improving, he returned to find her completely unresponsive as a result of a hypoglycemic crisis soon before 6 a.m. on October 19. Crooks died the following day. As a result, Norris was questioned in May 2003 about the 4 patients. After admitting to the crimes on October 12, 2005, he was charged with 4 charges of murder and 1 count of attempted murder. Norris denied predicting Hall's death at his trial in 2007. Although admitting to doing so in a police interview, he admits to delivering morphine overdoses to Vera Wilby and Doris Ludlam on May 17 and June 25, 2002 respectively. Norris, 37, was found guilty at Newcastle High Court on March 3, 2008, following a 19-week trial, and on March 4, he was sentenced to life imprisonment with a minimum of 30 years. Norris' motivation for the killings was dislike of elderly people, which was said to be motivated by the case of a female nurse who was convicted of killing patients with insulin in Glasgow in the 1970s, but found not guilty at a hospital near Norris' birthplace.